Today, a pregnant woman has ultrasounds, doctors, hospitals, pain medication, sterile delivery rooms, and emergency surgical teams on standby. And even with all of that, childbirth is still considered one of the most physically demanding and dangerous things a human body can go through. Now take all of that away, every single piece of it, no doctors, no hospitals, no medicine, no tools except what nature provides. And ask yourself, how did pregnant women survive 50,000 years ago? The answer is not what you expect, and it will completely change how you see both ancient humans and modern medicine. Pregnancy and childbirth in the ancient world was not a private medical event. It was a community experience, a survival mission, something the entire group participated in, because the survival of every new life meant the survival of the group itself. Ancient humans did not have science, they did not have anatomy textbooks, but they had something that turns out to be extraordinarily powerful. Tens of thousands of years of accumulated knowledge passed from woman to woman, mother to daughter, generation to generation. And some of what they knew still holds up today. Before pregnancy tests, before missed period tracking apps, before any medical terminology existed, how did ancient women even know they were pregnant? The answer is observation. Ancient humans were extraordinary observers of the natural world and of their own bodies. Missed cycles, nausea, breast tenderness, fatigue, appetite changes, these physical signals were recognized and understood by ancient women and the experienced women around them long before any formal medical knowledge existed. Anthropologists believe older women in the group, grandmothers, experienced mothers, served as the primary knowledge holders around pregnancy and birth. When a younger woman showed these signs, the knowledge holders in the group would recognize them immediately. The diagnosis happened through community observation and shared experience, rather than any medical instrument, and remarkably, evidence suggests ancient women were accurate. Remains found at ancient sites show women buried with indicators of late-term pregnancy, confirming these communities recognized and accommodated pregnancy well before modern medicine could. Ancient, pregnant women did not stop. They could not afford to. The group kept moving. Food still needed gathering. Water still needed collecting. But evidence suggests that as pregnancy progressed, the group naturally redistributed physical work. Lighter tasks moving toward the pregnant woman, heavier tasks absorbed by others. This was not formal policy, this was community instinct. The same instinct we saw with the Shanidar man, ancient humans protected their vulnerable members without being told to. Birth preparation in ancient times meant something completely different to what it means today. No hospital bag, no birth plan document. Instead, a chosen birth location. Likely a sheltered area within or near the main camp. Soft animal skins or plant material gathered for comfort and for the newborn. Experienced women positioned around the birthing mother, not as medical professionals, but as emotional anchors, physical supporters, knowledge holders who had seen birth before and would guide the mother through it. And here is what researchers know. Ancient women almost certainly gave birth in upright positions, squatting or kneeling, rather than lying flat on their backs, the way modern hospital births typically happen. This is not primitive, this is biomechanically superior. Gravity assists the process. The pelvis opens more effectively. Modern midwifery research actually supports upright birthing positions as often more efficient than the flat-back hospital position, which was developed largely for doctor convenience rather than patient benefit. Pain management in ancient births relied on what was available. Certain plant compounds with mild pain-relieving or muscle-relaxing properties have been identified in regions where ancient humans lived. Willow bark, which contains the same active compound as aspirin, was almost certainly known to ancient humans who observed animals chewing it. Physical pressure, rhythmic movement, warm water, and the constant physical touch and vocal support of experienced women around the birthing mother were the primary tools for managing pain. And research on modern unmedicated births shows these non-pharmacological methods are significantly more effective than most people assume. Here is the hard truth. Ancient childbirth was dangerous. Maternal mortality was high by modern standards. Infant mortality was higher. Without sterile conditions, without the ability to perform emergency interventions, complications that modern medicine resolves in minutes could be fatal in the ancient world. This is not romanticized. It is real. But here is what makes ancient survival remarkable. Communities that maintained strong social bonds around pregnancy and birth. Communities where experienced women guided births, where physical and emotional support surrounded the mother, where the group absorbed additional burden. These communities had meaningfully better outcomes than isolation would have produced. The social structure itself was a survival tool. Anthropologists studying skeletal remains from ancient sites have found evidence of women surviving multiple pregnancies and living well into what passed for old age. Proof that the ancient system, while imperfect, worked far more often than it failed. Here is what no one tells you. Several practices that ancient humans developed around pregnancy and birth: upright birthing positions, continuous physical and emotional support during labor, community involvement in the early postpartum period, skin-to-skin contact immediately after birth, are practices that modern medical research has repeatedly confirmed produce better outcomes. We did not discover these things. We rediscovered them after spending decades doing it differently and then slowly realizing that the women who had been doing this for 50,000 years without a single medical degree between them had figured out quite a lot. Ancient pregnant women had no hospitals, no pain medication, no doctors on call. What they had was each other. And it turns out, across 50,000 years of human births before modern medicine existed, that was enough to keep the species alive. Drop a comment below. Does anything from ancient birth practices surprise you? And if Doc Vault unlocks something today, you already know what to do. The vault opens again next week.